the health of our hospitals, next on Behind the Headlines.
This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Welcome to a new edition of Behind the Headlines. We're here in Williamsport, Pennsylvania today at Susquehanna Health, and our special guest is the CEO and President of Susquehanna Health, Mr. Steve Johnson.
Good afternoon.
Thank you so much for having us here.
Well, thank you, and I look forward to our conversation.
Oh, well, I think you have you're in a fascinating area up here in Williamsport. There's a lot going on. Get a lot of notoriety on TV these days with Marcellus Shale. We'll talk about that a little bit later. But why don't you tell us a little bit about your background and how you ended up at Susquehanna Health?
Well, Susquehanna Health has become home for my family. I personally am from New Jersey. Okay. Came here to go to college, Lycoming College to be specific. Met my bride-to-be and ended up raising our family here and received my master's at Marywood University. I had a couple of different jobs, spent a little time in the service, ended up here at the Williamsport Regional Medical Center in 1984 as the Assistant Director of Personnel. Oh. And I've had a dozen different job titles, I suspect, between then and now, but I've been here ever since. So we've really enjoyed our time here in North Central Pennsylvania.
Sounds like you grew up here.
I feel like I grew up here in many respects.
Now tell us a little bit about Susquehanna Health. I know that there are more locations than just the facility we're in today.
Well, Susquehanna Health now includes 4 different hospitals. We have Soldiers and Sailors Memorial Hospital in Wellsboro, Tioga County. We have the Muncie Valley Hospital in the east end of Lycoming County, the Divine Providence Hospital here on the east end of Williamsport, and the Williamsport Regional Medical Center. And we have a variety of other services too located up and down the valley here, but those are the major hospital facilities.
Do little satellite offices throughout the region?
Yes, yeah. Physician practices, insurance companies, etc.
And how many people do you employ?
4,000 people work here.
Throughout all 4 hospitals?
Throughout all locations,
That's
correct.
Pretty phenomenal. And how broad is the geographic region? Do you know? I mean, you sort of outlined it, but...
The primary market is Tioga County and Lycoming County, but we really consider ourselves serving each of the contiguous counties as well. So that's a total of 11 counties altogether.
Wow, that's a rather large employer in the area.
A lot of geography.
And
a lot of people, but in many respects, more geography than people in some areas. But
that's Pennsylvania, though.
That is Pennsylvania. And,
with agriculture as our mainstay, that's not surprising. So, now. Hospitals are always facing a lot of different challenges across the state, across the nation. Healthcare in general is always a really big issue. What are some of the biggest issues that are facing Susquehanna Health?
You know, here for us, the biggest challenge we have, I think, is dealing with the changes in the Accountable Care Act, the move from a volume-based business to a value-based business. Essentially what that's doing is changing the entire business model. So in addition to always keeping our patients first in all that we do, we now have to look for a different set of financial metrics upon which to base the business aspects of our organization's performance. So that change, I think, causes us, on the one hand, to have to be successful and effective inside of the old business model where volume is what drove the organization's business performance, and an environment where the outputs and the quality, efficiency, and cost equation drive the definitions of success of the organization.
Well, it sounds like that would be a big change from the way that hospitals have been run in the past.
It is a big change, and it's been described, in fact, as for leaders of an organization to have one foot on a boat, if you will, at a dock, and the other foot on the dock while the boat has been released and the boat is now drifting away from the dock, and we're trying to hang on and not
one leg
fall in and be completely soaked, if you will.
Well, so we've outlined some of the problems. How is Susquehanna Health addressing the issues that you're facing, this one leg in one boat and one in the other? What do you have to do to address these issues?
Well, for us, we focused on quality as our number one priority, and organizing ourselves around our patients and their needs first, and then assuring that the quality that we're providing has three major effective components. The first is clinical quality, so assuring good evidence-based service delivery. We have an outstanding medical staff focusing on all the right things when it comes to clinical quality. Secondly, we focus on assuring that the mechanics, the structural components of the organization, the facilities, for example, and the technology is all state-of-the-art and as good as it can possibly be. And then third, that our relationships with our patients are outstanding, and that patients want to be served here. They're loyal to the organization, if you will. It's really focusing, I think, the organization on those three aspects of quality, and then doing all that in a way that makes good business sense. That's been our focus, and to date, that's been the core and cornerstone, you might say, of our success.
It seems you can hardly walk into any hospital in Pennsylvania right now without running into some sort of construction or some sort of improvements even to the infrastructure, and you have the same going on here. Is that an ongoing challenge for you to keep up with the look of the hospital and the facility?
It is an ongoing challenge.
How old is this hospital? I mean, that might be part of the reason.
Well, the medical center, Williamsport Regional Medical Center, is the oldest of all four facilities, and it was established in 1873.
Oh, my goodness.
And at this location started, actually, in fact, the oldest building still on this location was built in 1923. So it's been here quite some time. The other organizations are about 50 years old apiece, and we've just concluded a major modernization and renovation and expansion program. When I say completed it, the new additions are complete, the renovations are complete. We have some destruction work to do. Next, we'll actually tear some old buildings down. That's the next phase of work. And then our plan is to always have something under construction or something under a major modernization or remodeling effort, so that we don't get behind again, so to speak, in terms of the caliber and quality of the facilities.
Well, and it's a competitive business that you're in, too, so there's probably all that going on at the same time. Okay, let's talk a little bit about the federal government. I know that hospitals aren't always on good footing with the federal government and payments and everything, but tell us a little bit about what sort of challenges you have with the federal government, and then we'll talk a little bit about the state and the governor's budget coming up.
Well, the federal government changes, again, are principally driven through the Obamacare plan, the Accountable Care Act, if you will. And again, I think the plan or the concept of the Accountable Care Act had a lot of very admirable goals. For example, reducing the number of uninsured in this country, providing an insurance vehicle for the working poor, building a system that requires fewer cross-subsidies from other payers. Those are very admirable goals. The mechanics of how that's being deployed, on the other hand, and the sequencing and the scheduling of the changes in policy and procedure are very daunting, very difficult to manage, and we've spent a tremendous amount of time there. In fact, on a national basis, the federal government has stripped out about $150 billion from payments to hospitals and health systems for the services they provide, in return for a promise that there'll eventually be more coverage for these uninsured and underinsured patients that are frequently cared for at no charge now. All that's in transition. We're not sure how all that's going to work out, and whether the revenues associated with new patient volumes will actually materialize, or whether we've given up revenue in return for nothing. That's our concern right now, and managing through all this is a real challenge.
Well, now, part of the expansion of the Medicaid program and the Affordable Care Act, the governor was supposed to opt in or buy into the federal plan but chose not to. How are hospitals reacting to, how is your hospital reacting to the governor not going down that road?
Well, the governor's got challenges of his own. He's trying to sort through what the implications of this policy change are to his administration. And in that sense, thinking through both the short-term financial implication and the long-term financial implications are frankly the job that he should be focused on. And that's what he's doing now. Now, he's chosen, at least in the short term, to opt out and to allow the federal government to assume this responsibility themselves. The federal government's not really defined how it will do that yet, so we're really not sure.
And that's the governor's biggest criticism. How can we opt into something that we don't have any detail on?
That lacks so much definition.
Right.
Well, in some respects, welcome to our world, because that's what we're dealing with the entire Accountable Care Act. But that having been said, what we hope to be able to do over the course of these next several years is work together with the governor's administration to find ways to make the current Medicaid plan work and, as appropriate, expand that service or at least accommodate the federal government's program expansion in the Commonwealth.
So tell us a little bit more about the Medicaid challenges that hospitals face. Is that one of the biggest issues in terms of payment from the federal government?
Medicaid is the poorest payer of the federal government programs, and that's why it receives as much attention as it does. It's about 10 or 15% of our local business. It's more than that in some major metropolitan areas, and it's less than that in other more rural areas. But the fact is that the coverage for Medicaid recipients runs about 84 cents of reimbursement for every dollar spent. So that means that 16 cents of every dollar is a shortfall. And it really ends up being part of a charge structure or a negotiated contract with another payer. So somebody else pays for their own services plus subsidizes the services of those Medicaid recipients for which we're not paid the entire cost.
Governor Corbett recently announced his 2013-14 budget, and of course hospitals are impacted by that. If you could write a letter to the governor, what would you say about this year's budget? Or have you written a letter to the governor?
Not yet.
Not yet.
I would say, but if I was going to write one, which maybe is a good idea, I would say good start.
Okay.
I think...
you haven't felt that way over the last couple of years, I imagine, though.
That's true.
Yeah.
I actually think this is the best start of the budgets that he's put together, and for that matter of budgets put together by previous administrations. So I compliment him in that sense.
He could use that, so you might want to write a letter. So what in particular are you most pleased about?
Well, since we're talking about Medicaid, the piece I'm pleased with there is that the inpatient services provided under the Medicaid program are continuing to be funded at previous levels. And we had worked with his administration and with the prior administration to modernize the the Medicaid payment system. And we've designed a couple of unique components of that, which the governor has indicated a willingness to continue to support. That I think is a great accomplishment, and it sends a very good signal about the potential of working together to address other Medicaid modernization issues. And so that's why we're at least optimistic about the starting point.
Good. Well, let's go back to talking about you a little bit more. I understand that you are the chair-elect of the Hospital Association this year. Is that correct?
That's correct.
Congratulations.
Thank you.
Tell us a little bit about the Hospital Association first, and then what your responsibilities will be as the chair-elect.
Well,
if you know what they are so far.
You never really know entirely what you're getting into when you accept these kinds of appointments. But for the sense that I have, I will share that with you. We have about 250 hospitals in Pennsylvania that are members of the Hospital Association. The Hospital Association is principally a lobbying and education organization. It works with the state government and the federal government around issues associated with the delivery of health care here in the Commonwealth. And it provides educational services and support for those of us who work in the industry and in all disciplines. So as an organization, it's principally focused at improving the overall quality and access to services, to healthcare services here in the Commonwealth.
That's great. Now, do you have an agenda as the chair-elect, or are you just going to get in there and fly by the seat of your pants, so to speak?
Well, I can't say that I've built an agenda per se.
Okay.
But I think, the focus on quality, the focus on access, and the focus on dealing with these tremendous changes in our industry, the changes in relationship with payers, the changes in relationships between previous competitive healthcare systems, now working to cooperate with one another to do the right thing for our patients. There are tremendous opportunities inside of each of those areas. The way we work with our medical staff, a lot different than what it had been just 10 or 15 years ago. So my focus will be on bringing the payer business, the physician-provider business, and the competitive industry parts of our business all together for the betterment of our patients and the sustainment of local hospital provider organizations.
Great. Well, we do wish you luck with your new responsibilities. But I mentioned at the very beginning Marcellus Shale. We're really in the heart of Marcellus Shale country here. Williamsport is featured in commercials. Growing, booming, everything's phenomenally positive about this area in a way that it hasn't been for many years. What have you personally experienced about this area, and also how have you seen it impact the hospital, or has it impacted the hospital in any way?
Okay, sure. Great questions, but just one minor correction first.
What's that?
Williamsport's always been on the map.
I appreciate that
for
correction.
For a variety of different reasons.
Yes.
The logging industry at the
Yes.
turn of the century, Little League Baseball
Right.
More recently, and now Marcellus Shale.
Mm-hmm.
So we just like to kind of remind our neighbors
I stand
of that.
corrected.
No, just kidding. But the Marcellus Shale is kind of the latest development in the area, and while obviously it's been here for a long time, the technology in the industry has recently allowed for access to the Marcellus Shale, which is in the ground between 1.5 miles and 2 miles. So it's kind of a remarkable technology. But there's been drilling for natural gas and oil in the Commonwealth here for over a century. So it's really not that new. What's new is the technology that allows us to access it in an economical way. So over the last couple of years, there's been a tremendous growth spurt in the number of wells being drilled, and now more recently in the number of gathering lines and pipelines being built to get the gas to market.
So more people are employed in this area now.
So we've been told that we're among the fastest growing communities in the country right now, ranked among the top 10 for the last couple of years in a row. We've seen the average compensation for our community residents go up substantially in the last couple of years. We've seen our unemployment drop and stay below state averages for the last couple of years. So those are all real good things.
Well, we're going to have to end on that very positive note here today. It's great news about Williamsport and this region in general, of course. But we want to thank you so much for being our guest today and spending some time with us talking about Susquehanna Health. Thank you.
It's my pleasure. Thank you very much.
We'll be back for another segment of Behind the Headlines in just a moment.
Behind the Headlines is brought to you as a public service by the Pennsylvania Business Council, envisioning a commonwealth in which residents enjoy a very high quality of life in sustainable communities. The Council works aggressively to define key long-term policy strategies and solutions that make the Commonwealth more competitive, creating and sustaining a better Pennsylvania. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, And by the Hospital and Health System Association of Pennsylvania, helping hospitals to provide healing, health, and hope to communities across the state. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by Daily Underwriters of America, a better way for truck insurance. And by Penn Waste, your best local choice for your waste removal and recycling needs.
Welcome back to the second edition of Behind the Headlines. In the second edition, I'm joined by Susquehanna Valley Center for Public Policy's Chairman, Ed Arnold. Ed, welcome back to the show.
Good to see you again, Charlie.
It's nice to see you. This is an official Arnold Report segment. And on the Arnold Report segment, we have encouraged our viewers to please write in and ask questions. And you have the world of experience and a lifetime of experience in business and finance. And you can offer some good interpretations and some good answers to our viewers. We have a few questions here that have been sent in since you've been on last. One is about the states that are minting their own currency. Right now, several states have decided that they're going to have their own currency. One of our viewers is asking you, will these new currencies be worth holding and be worth using in the future?
I must admit I do not know a lot about this. My answer overall is no. America is, by its definition, a United States. We are very, very tied together. So therefore, to think that a state could exist upon its own, if in fact the American currency or the American economy collapses, there is no one state that could possibly survive on its own. There's too much trade between the states. Also, the amount of money transferred from the federal government through Social Security, Medicare, Medicaid, and all the other government programs, and also the military spending and all other government spending, there is no state that could be strong enough to stand upon its own.
Well, talking about fiscal integrity, there are some in Washington, some in Harrisburg, who believe that in order to force the national government to have its first budget, we haven't had a budget for 4 years in Washington, to create a budget for the first time in 4 years and to control government spending, that we simply should refuse to raise the national debt ceiling. How do you feel about the national debt ceiling?
Well, first of all, we have had a budget. We've had what they call a continuing budget. So all you're doing is kicking the can down the road. If you voted not to kick the can down the road and said, no, we will not approve a continuation of a present budget, therefore you must have a budget now, or the government now will have a very major problem. The debt is like saying to your wife, you can use the credit card all you want. When the bill comes in, we're just not going to pay it. Once you've authorized the payments, not to pay people for what you've spent is the wrong time. The time is not to spend it. So therefore, what we should be doing, we should be getting serious about our budget, really work at where are we spending our money, how are we spending it, and how to, in fact, start to control spending. Unfortunately, we have a very serious problem. We have a president who believes that the solution to all problems is more taxes. He does not want to, as is most recent, when they had this so-called compromise, it was 41% tax increase, 1% reduction of spending. Mm-hmm. We have got to do both on a 50-50 basis or something like that. Our government is out of control. We are spending way too much. And very frankly, it is true. Too many people are dependent upon the government for their livelihood. That it's got to be reviewed, but it's got to be done by the budget, not arbitrarily saying we won't pay the bills we've already authorized.
Okay. A third viewer has written in about something you've addressed before, but this situation seems to change from month to month, and it's still very volatile today. This viewer is asking, how long will the euro be used, and will the euro survive?
Well, it is ironically that he says that. I guess I would say right now there is what I call a race to the bottom. Everybody is printing money like an unbelievable rate, whether it's the Eurozone, which is their central bank, whether it's our Federal Reserve, or whether it's the Japanese Bank of Japan. We are all acting extremely irresponsible. The question is who is going to do the worst job, and therefore their currency will collapse.
They're all trying to undercut each other's currency to make their exports more attractive. Is that
but
the case?
Also, basically, because they're spending way more than they're taking. They don't want to increase taxes, yet they want to keep spending. Mm-hmm. So really, yes, it's partly for the trade thing, but it's primarily because, like our government, we're only taxing at the rate of $2.5 trillion, and we're spending it close to $4 trillion. So basically, we don't want to cut down our spending, so therefore we just print money, which indirectly is driving down the currency. Now, the reason why I think the better question should be which currency will make it to the bottom, and my answer is the dollar. Why? Because basically we all are printing money, but we have a second factor. Both Europe and Japan have a relatively balanced of trade. In fact, if anything, they have a surplus of trade. The only country that has a negative trade balance with China is us. We have a massive trade balance problem with China. Europe has a positive trade balance with China. So therefore, it is basically because of our trade balance plus our printing, American dollar, unfortunately, is in the greatest danger.
Well, the fourth viewer here, talking about the trade balance, one component of that trade balance, of course, is over time has been the importation of oil. Our fourth viewer wants to ask you, when will gasoline's price increase? And how high will the price of gasoline go up? Now, there are certain assumptions in this question.
We'll answer that very quickly and very simply. I don't believe it will go up unless Obama decides to stop fracking, which he is trying to do because he wants to damage the economy. That basically the fracking is a tremendous amount of oil, not just natural gas being found, and therefore I do not believe the price of gas is going to go up significantly. I'm surprised it's as high as it is right now.
Okay. Why is the stock market so high? A fifth viewer asks us. There seems to be some psychology there.
You can invest in two things, bonds and stocks. Our government is artificially manipulated, as all world governments, to make interest rates extremely low, which makes buying bonds a very poor investment. Normally, people, as they get older, buy more conservative and buy bonds. They're being forced to buy stocks because bonds yield poorer than inflation. So therefore, the reason the market is going up is money is switching, and it has been doing this now for the last maybe 6 months or so, from bonds to stocks, and therefore supply and demand. There's lots of money going in the stock market will go up.
Okay. Sixth and final question for the Arnold Report today, Ed. In light of the president's reelection, what should the average investor look to invest in?
Basically invest in the world, diversify. The easiest way to do that for the average person is by large dividend-paying, very important, dividend-paying blue-chip stocks. Blue-chip stocks, generally most of them, more than half their businesses in the rest of the world. So you're really investing in the world, even though they are American companies. So basically, at this point, they have not performed as well in the last 2 years as have the more high-flying stocks. So therefore, they're actually even a better value.
Okay. We want to thank you very much for the answers to these questions. And again, to our viewers out there, if you have any questions for Mr. Arnold about the world of finance or business, please don't hesitate to send them in. The email is on the bottom of the screen for you. And we will see you next week on a new edition of Behind the Headlines. We'll see you then.